In the name of Allah, the most merciful and the most gracious. Students, our today's topic is joints. A joint is an articulation or a place where two bones or bone and cartilage come together. Or another definition is joints occur where bones meet. The function of the joints is not only to hold our skeleton together but also give us the mobility. Means they help us, they allow the movement of different parts of the body. And the scientific study of the structure and function of joints is called arthrology. Now the joints are classified on the basis of structure and movement. There are three different categories of joints. The fibrous joints, which are also called immovable joints. Cartilaginous joints, slightly movable, and synovial joints, freely movable. Fibrous joint is found between most bones of the skull, called the sutures. They are found in the shaft regions of the long bones, in the forearm and in the leg. And they are also found in the root of a tooth and the socket in the maxilla or mandible. So we will discuss them one by one. First of all, we will talk about the sutures. Then we will talk about syndesmosis of radius and ulna, and then we will talk about gum fosses. Syndesmosis are the joints which connects the bones by the ligaments, the bands of the fibrous tissues. When the fiber length varies, so the movement of the joint varies. The short fibers offer little to no movement, and the example is inferior tibiofibular joint, and the longer fibers offer a longer amount of movement. Example is interosseous membrane, interosseous membrane which connects radius and ulna. Now if we talk about the sutures, they are the rigid interlocking joints of the skull. The growth of these sutures is only during the youth. Means they allow for growth only during when the person is young. They contain short connective tissue fibers that allow for expansion. In middle age, sutures become ossified and they fuse. Immovable joints join skull into one unit that protects the brain. Sutures are closed, immovable. They are referred to as synostosis. Lastly, we will talk about gum fosses, which are peg in socket joints. Their only example is teeth in the alveolar sockets. The fibrous connection is the periodontal ligament that holds tooth in the socket. Now in the diagram, you can see all three different types of joints, which are the subtypes of fibrous joints, and these joints allows very little to no movement. Suture lines are very much obvious in the first diagram, which are present in the skull. Then syndesmoses are the joints which are present in the connecting membrane between ulna and radius. And the third type, that is the gomphoses, which shows a socket in which a tooth is fitting. You can see the root of the teeth, which is connected by the periodontal ligaments. The second type of joints are cartilaginous joints. These joints occur at the adjacent bones which are united by a cartilage. A cartilage is a tough but flexible type of connective tissue. So we can talk about the cartilaginous joints as these types of joints lack a joint cavity and involve bones that are joined, and they are joined by either hyaline cartilage or fibrocartilage. So by now you are well familiar with three types of cartilages which we discussed in the previous topics. The cartilaginous joints allow very little movement, and these are present in the vertebral column and other regions. The examples are costal cartilages that will attach the ribs to the sternum, then the pubic symphyses, which are the intervertebral disc, the synovial joints. Pubic symphyses are the joints which are shown in the diagram with the blue color, the small region. This is called the pubic symphysis. Then comes the third type of joints, the synovial joints, which are freely movable. In this type of joints, the ends of the bones are covered with hyaline cartilage again. The ends of the bones are covered with hyaline cartilage and they are held together by a surrounding tube-like capsule of dense fibrous tissues. Now you can see in the diagram the lines or the cavity which is of blue and black color lined by different membranes. This is called the capsule of dense fibrous tissue. The joint capsule is composed of an outer layer of ligaments and an inner lining of synovial membrane which secretes the synovial fluid, and this fluid will allow the movement. The examples of synovial joints are hinge joint, which can move only in one plane, pivot joint, ball and socket joints, and the gliding joints. So all the four categories of joints come in this category of the synovial joints. Our next topic is the disorders of skeleton. Before that, I would like to tell you the techniques which are used for the joint replacement. So if there comes a disorder of the joints or the joint is not working properly, the joint replacement therapy has been introduced. Many joints of the body can be replaced by artificial joints. The joint replacement therapy is called arthroplasty, and the artificial joints, they may be composed of metal such as stainless steel, titanium alloys, and in combination of modern plastics. The bone of the articular area is removed on one side. This is called partial joint replacement or hemi replacement technique. And when both sides of the articular area are removed, it is called the total joint replacement technique. In this artificial articular technique of joint replacement, the articular areas are glued to the bone with a synthetic adhesive, and the synthetic adhesives are many in the market. Then the disorders of the skeleton. These skeletal deformations may be hereditary, they may be hormonal, or due to the nutritional deficiencies. We will talk about them one by one. The common disorders of skeleton are slipped disc. In the diagram, you can see that each intervertebral disc is a cushion-like pad which is composed of an inner semi-fluid nucleus pulposus which acts as a rubber ball to give disc its elasticity and compressibility, and a strong outer ring of fibrocartilage. The annulus fibrosus. The annulus fibrosus holds together successive vertebrae. So the disc's inner side is divided in two parts: the inner nucleus pulposus surrounded by the annulus fibrosus. The discs act as shock absorbers during walking, jumping, running, and to lesser extent to bend laterally. Severe or sudden physical trauma to spines, for example from bending forward while lifting a heavy object, may result in herniation. Herniation is it is the replacement of the discs. The herniated disc, which is also known as the slip disc, usually involves a rupture of annulus fibrosus, which is the outer region, followed by the protrusion of the spongy nucleus pulposus. Means the spongy part will protrude out from the annulus fibrosus. The effects of this protrusion presses spinal cord or the spinal nerve, which produces very severe pain or even destruction of these nervous structures. Slip disc is misleading as it is not the whole disc that slides out of the position. The cure of this slip disc is to treat with bed rest, traction, pulling, or the painkiller. And if these techniques failed, the disc may be removed surgically. In the diagram, you can see the problems of the discs. At the top, a disc is normal. At second point, the disc has started degenerating. The third one is the bulging disc, which has been bulged out like a ball from one side. In the herniated disc, you can see the blue balloon, which shows the protrusion of the nucleus pulposus. In the fourth disc, you can see it has been thinned out, means its thickness has been affected. In the next disc degeneration with osteophyte formation has been shown. The next is spondylosis. Spondylosis is the immobility and the fusion of vertebral joints. Cervical spondylosis results from the chorionic cervical degeneration, which results with the herniation of the discs, and the phenomena is during aging process. You can see in the diagram the disc may bulge out or the bone spurs and the disc is pressed in between, and in the third case the disc has become narrowed. All these three conditions would collectively result into the spondylosis, which is the normal cervical uh, cervical deformity or the disorder. Then comes the sciatica. Sciatica is the severe pain of the leg in which the sciatic nerve has been swollen up. There is a very severe pain which is radiating over the course of sciatic nerve. Sciatic nerve is shown with the red color in the diagram, which causes severe pain, weakness or numbness or tingling in the leg. The causes of the sciatica are the injuries to the pressure to the sciatic nerve. The slipped disc may also be the cause of sciatica. Some pelvic injury or fracture and tumors. The recovery process of sciatica is usually slow and incomplete. The next disorder of skeleton is arthritis. Arthritis is of two different types, which are the main types of arthritis: acute and chronic. Arthritis is basically the inflammation or it is the degenerative disease that badly affects the joints and which ultimately results in the pain, stiffness and swelling of the joints. In arthritis, basically the synovial fluid is removed. The acute form of arthritis usually results from some bacterial infection or invasion of the bacteria, so it will be treated with antibiotics. Symptoms of arthritis are: you feel pain when you walk, which may later occur even at rest. Creaking sounds may be heard in the joints when you move, and you feel difficulty in getting up from a chair and pain on walking up and down stairs. The types of arthritis are osteoarthritis, rheumatoid arthritis, and the gouty arthritis. Osteoarthritis is the progressive disease in which the articular cartilage is gradually softened and disintegrate. This type of arthritis can affect the knees, hip and the intervertebral joints. Now in the diagram you can see the cartilage starts degenerating and it has been shown with the red color, and it has started eroding. Second type of arthritis is rheumatoid arthritis. It is the result of an autoimmune response. It is basically an autoimmune disorder in which synovial membrane becomes inflamed due to faulty immune system. You can see the synovial membrane has thickened or inflamed, and you can see the degraded cartilage in the diagram, which results in the rheumatoid arthritis, and the bones or the joints has been deformed or D-shaped. Then comes the gouty arthritis. It results from a metabolic disorder in which an abnormal amount of uric acid is retained in the blood and sodium urate crystals are deposited in the joints. The most common joint affected in this joint disease is the big toe of your foot, that is shown in the diagram. This was all about today's lecture. Thank you so much.